There were two other pieces. There are a number of objections posed to this as a policy, and the most fundamental being that all the pieces that are used to make it happen are imperfect. One of the central messages of public health is that if you do things which in themselves are imperfect, but you do several of them, you can get really, really good results. There's also great concern about damage to the economy, or further damage to the economy, which I think Mr. O'Brien will address in a little while. We would simply make the point that the limited evidence that is available, which is from the United States, where every conceivable variety of lockdown has been tried, and from South Korea, where no lockdown was tried, is that the economic damage in a region of those countries was much more strongly related to the amount of infection. So it really is the virus that drives the economic damage. And this is the same as the message that comes from analysis of the 1918-1919 flu. For the green zones, the logic of that is that there are many areas of the country where there are very few cases, mostly rural counties. Roscommon is a good example. In those areas, if it is relatively straightforward to stop the disease completely, and as you get areas to green, you can merge those areas and you produce a larger and larger green area which covers the country. And that is the position we were in early June, and we can absolutely get back to that position again because we've already done it. And what you're doing is you're going from managing one outbreak which is spreading across the countries, affecting many different counties, to 26 smaller outbreaks, many of which are tiny, many of which involve single families or single individuals, and could be dealt with effectively and stopped from spreading effectively. In the areas in which infection is driven down to zero, in the green zones, which will initially be county level areas, life can return substantially to normal. The price of that is no non-essential travel into those areas from other parts of the country. The plan is to expand those areas as quickly as possible to cover the entire country, and hopefully in collaboration with the Northern Ireland government, where there's a very long history of public health cooperation, to extend it to cover the entire island. It is the view of colleagues of ours who have dealt with epidemics of things like Ebola, malaria, cholera in the most difficult circumstances imaginable that this is entirely feasible. And it's also a view supported by the evidence from other countries. And what you get to is the situation they have in New Zealand. Now, in New Zealand, there has been an outbreak in the last 2 days, which appears to have been caused by a failure in their quarantine in one city. And that city, life is severely disrupted. But the outbreak will be brought under control. And the rest of the island, life continues. Business continues. We are bringing back our children to school in September, and it's crucially important that we do so. All the international evidence says that the lower the amount of this virus circulating in our communities, the safer it is for our children to return to school. The alternative of living with the virus is difficult, as the people of Kildare, Laois and Offaly have discovered in the last week or so. Our expectation is that if we continue to live with the virus, that such outbreaks with rolling closures will be a feature of life until a vaccine is available, which will be the middle of next year. It will be June 2021 at the earliest, if everything goes well, before we have large supplies of vaccine available for our population. If things do not go well, it could be a lot longer. We could be waiting quite some time for a vaccine. Thank you.
Thank you very much.